Tonight we're examining healthcare careers. And so far we've looked at several examples of caregivers on the front lines of patient care. But there are also hundreds of healthcare professionals who work behind the scenes. Communications Coordinator Helene Gleason joins us now with a look at some of these less visible but very valuable careers that are in high demand.
Have you ever wondered how nurses and doctors determine what's making you sick? It may surprise you to learn that 70% of diagnoses are made not at your bedside, but in a laboratory. And that journey to a diagnosis and treatment usually starts with a little prick of a needle.
We hear you're not feeling well today. We're just going to get a little blood work to see what's going on.
Phlebotomists are specially skilled people who train in the collection of blood specimens. And there's a great need for those as well.
Okay, real deep cough.
After your blood and sputum samples are collected, the phlebotomist and nurse send them off to the microbiology lab, one of 5 labs at Memorial, where the behind-the-scenes investigators we call medical technologists are hard at work.
One of the major differences of the microbiology lab is we do cultures here, where we actually grow organisms, bacteria, or fungi, and that takes a while to do. Every time you pick up a culture plate, you're seeing something different. And it's always a challenge to try to identify those organisms and let the physician know what's causing the infection.
We put some of the specimen onto each of these and we'll identify any pathogens that may be present.
While the plates incubate overnight, let's turn our attention to another laboratory career, with those working in the histology lab. Histo is Greek for tissue, and these histotechnologists are laboratory professionals with a very special job. They find the answers to medical questions raised by the living and left unanswered by the dead.
Anybody, when they hear of laboratory, they automatically think of blood or body fluids. And tissue analysis sometimes gets left to the side because it is behind the scenes, but it is very important.
Especially if you're one of the thousands of women who will undergo a breast biopsy this year. What happens to a tissue sample once it's removed, and how is it tested? Once the tissues that come through here are stained, the samples are placed in tissue cassettes and will process overnight. In the meantime, let's check back in with our medical technologist, Kathy, in the microbiology lab.
We look at the blood plate for growth. There's several types of strep pneumoniae colonies.
The labs at Memorial perform 3.5 million tests a year. Abra Elkins, director of Conemaugh School of Medical Technology, says that their training here prepares students for just about any situation.
I get the feel of not only the techniques and the procedures that are needed to be done in the laboratory, but also the flow of the work and the change in intensity of the work.
Now let's return to our histology lab, where they are preparing the breast tissue for analysis to determine if it's benign or cancerous. After the tissue goes through a chemical process, it's dehydrated and the finished product is encased in paraffin or wax, then cut into ultra-thin sections, a process that requires practice, something that students at Conemaugh School of Histology get plenty of.
It takes a great deal of repetition to become good at it. It's like you're learning an art form or a craft.
When the slides are ready for reading, they're given to Dr. Ashcraft.
Okay, so this looks like fibrocystic change, and it is a benign condition.
While histotechs are responsible for helping define diagnoses like this one, they're also relied upon to find answers from beyond the grave.
You know, we're the forensic morgue for 5 counties at this time. A well-done autopsy can help convict a guilty person, exonerate an innocent person, get the benefits for a family that they deserve. In a lot of cases, it's a good closure process for the families.
There are many job opportunities for histotechs, so much so that the School of Histology at Memorial has begun a dual enrollment.
We have people, and probably 60% of the lab is probably going to retire about the same time. So we're going to have a lot of openings. We employ around 200 people in our laboratory.
For every caregiver you see, remember, there are several more healthcare professionals you don't see.
There's only so many doctors and so many nurses, and behind each of those roles are other critical support personnel, the lab technicians, the micro technicians, and we all play a vital role. We're all part of the same team.
If you're interested in learning more about Memorial Medical Center's histology program, call 534-5844. And for the medical technology program, you can call 534-5578.